the clinical podcast series brought to you by the American Academy of Optometry Foundation. Today's episode is entitled Safety and Efficacy of Lotilaner Ophthalmic Solution, 0.25% for the treatment of blepharitis due to Demodex infestation. I'd like to thank our host, Dr. Tom Quinn, our topical expert, Dr. Milton, and our topical editor, Dr. Kelsy Steele. And now it's my pleasure to begin today's broadcast.
Welcome, you of curious minds, to the American Academy of Optometry's clinical podcast series. Today's episode will be discussing a paper that explores the safety and efficacy of a novel medication for the treatment of Demodex blepharitis. I'm Dr. Tom Quinn, and our guest expert for today's episode is Dr. Milton, a distinguished practitioner, lecturer, researcher, key opinion leader, man about town. Please give a warm welcome to Dr. Milton.
Thank you very much, Tom.
It's great to have you here, Milton. Thank you so much. And this is right up your alley. I know you've done a lot of work with Demodex blepharitis, so I'm really curious to hear your thoughts about this new paper that was published in August of 2022 in the Journal of Contact Lens and Anterior Eye, authored by Roberto Gonzalez Salinas et al. Milton, let's start with what is Demodex blepharitis and what quick tips can you give to aid the practitioner in determining whether a blepharitis has Demodex involved?
Well, Demodex is essentially a so-called parasite. And what it is that it's one of the most common parasites known to man. In fact, they say that 100% of the people over the age of 60 has Demodex. So it's extremely common. We see it all the time. Now, we're all familiar as eye care practitioners with blepharitis. And essentially what blepharitis is, we describe that as what? We describe that as lid disease. So what Demodex blepharitis is blepharitis that's due to the Demodex so-called parasite. So, back years ago, what I used to think is that we have blepharitis, like this run-of-the-mill blepharitis, and then we have Demodex blepharitis. But now what the studies are showing is that actually this is Demodex blepharitis, and this is run-of-the-mill blepharitis. In fact, the studies are showing
Demodex is more the rule than the exception.
Absolutely. So in other words, studies are showing between 80 to 90% of all blepharitis is actually due to Demodex.
Okay. So what did this paper study about Demodex?
Well, essentially what it is that this was actually a phase 2 study done by the company Tarsus that is using the lotilaner drug for Demodex. And what lotilaner is, as a disclosure, I did probably a lot of their proof of concept work with this drug. But what it is that lotilaner is actually a veterinarian drug. It's for dogs and cat Demodex. And it's actually an oral drug for the dog. So what they've done, or dog and cat, so what they've done is that they've taken the oral drug and they made it into a topical drug. And they're also reverting that for humans. And so this is what a study of the phase 2 study, clinical study for lotilaner for Demodex. What they do is that, when you take a look clinically, when you take a look at Demodex, there's really two ways of diagnosing. First way is taking a look at lid debris. And if the lid debris, or shall we say cylindrical dandruff or collarettes, or whatever you want to call them, if it's located at the base of the lash, then that means that's indicative that that's actually Demodex. If it's away from the lid, not at the base of the lash, then that's really run-of-the-mill blepharitis. The second thing is that you go ahead and you epilate. In other words, you pull the lashes, you look under a light microscope, not a slit lamp microscope, because the magnification is not good enough, and you can actually see the mite. So that tells you what the mite density is. So what they did was that they did both of these tests, putting the patients on lotilaner topical, and over time to see what the results were.
How often did they instill the medication, Milton?
I think it was a BID medication.
That's what I read.
At that time. Yeah. And what they did was the study results were is that at day 14 and day 28, they found a decrease in lid debris. And also at day 28, they found a decrease in mite density.
Okay. So did they come away with a recommendation for how long you should use the medication, or how many?
No, because it's only a phase 2 study. I'm sure after phase 3 they'll be able to see. Right now the drug is not available. We're doing this podcast at the end of 2022, and probably they're thinking that it's going to be released in 2023. So then we'll probably learn more about it after the clinical data, phase 3, and everything like that is released for approval.
Were there any adverse effects from the topical medication? Did anybody have any problems with it?
Actually, what happens is that the tolerability was actually pretty good. About 70% find it pretty comfortable, or slightly, not, 70% actually found it very, very comfortable. As you know, the conventional treatments now are tea tree oil, and that burns and stings. So, there's a tolerability problem with tea tree oil. So this is a very, very more of a milder, or shall we say more of a tolerable, more comfortable type of medication. So what's interesting is that they talk about mite eradication after 28 days. And, when I take a look at that, the new thinking now, I had a conversation years ago with Kathy Mastroda, and this was, Kathy Mastroda, optometrist extraordinaire from Brooklyn, New York. And what she was mentioning is that she was talking about the relationship between man and Demodex. And what she was saying is, she was mentioning, well, perhaps maybe the relationship is not parasitic, but it's actually commensal. So when you take a look at what the relationships are, there's actually 3 different relationships. You have the host and you have the occupant. The host is the human, the occupant is, Demodex, or the mite. So if you have a parasitic relationship, the mite benefits, the host is harmed. Right. If you have a commensal relationship, the mite benefits, but the host, there's no harm to the host. And if you have a mutualistic relationship, the mite benefits and the human benefits. So now the new thinking is that perhaps maybe our relationship is mutualistic, because the mite will consume excess oil and actually keep the hair follicles clean. So now the thinking is that, do we really want total mite eradication, or do we just want control? And these are some things that, we need to look more into.
Another example where science just prompts more questions to come to mind. Thank you, Dr. Milton Hom, for your expertise and insights on this topic. We appreciate your participation, and thank you all for listening.
And a special thanks to CooperVision for their educational grant to make it all happen.